Hello, medical staffing producers. My name is Gerrit Salinas, Director of Medical Staffing here at Snelling. I am super excited to inform you that we have collected a quality leads list of Medicare approved dialysis clinics, nursing homes, and home health aid organizations. They're all within a 50-mile radius of your office location. In this email, we have attached all three of these lists in one form or another that would be best utilized by you while looking to establish a strong sense of leads to put into your funnel for sales moving forward. First, I would like to talk about our dialysis center list. And let me clarify before I move on too far that all of these lists are Medicare approved organizations. The reason I am sending you leads of Medicare approved organizations is that Medicare has established a sense of confidence that these organizations are running at a top-notch legal way, and they will likely get their reimbursements from Medicare in a timely fashion, which gives me confidence in knowing that they will pay you on time for the services we provide, and that they will provide a high quality work environment for our field employees. Now, on the dialysis center list, this list that we're sending to you is a list of all locations, their addresses, and phone number, contact information. Unfortunately, that's all that was provided in this research. So my suggestion is, before you call these organizations, stop and take a moment. Go on to linkedin.com and research the organization and see if you can find their decision makers. It should be fairly easy based on the employees who are on LinkedIn, based on their job title, and hopefully they've provided a brief job description. If you've reviewed that description and it looks like this is an ideal individual for you to approach, then there you've got a strong contact to go ahead and put into your contacts either in Salesforce or Impact and be ready to make your first call. Dialysis centers typically will use CNAs, LVNs, nurses, and a handful of technologists, for example a med tech or a phlebotomist or a histologist. These organizations typically are going to be running scans and diagnostics on a handful of vital information that they can provide or collect from their patients. Great opportunity for some volume staffing. And I highly recommend, again, do your homework before making the call, look up and find those decision makers, maybe even go onto Google News and do a brief search for that organization and see if they've been in the news in the last 3 or 4 months. This should help provide you with good information to start your introductory call, and hopefully you can tailor that introduction to be specific to what is important to your client as well as the decision maker you're trying to approach within that client's organization. The next list of the 3 lists that we're sending over is our list of home health agencies. On this list, as you can see, we've got some great information that is already available on the first page based on the link that we've provided to you. So for example, you have the agency name, phone number, and then across the top here it lists whether or not they provide nursing care, physical therapy, occupational therapy, speech therapy, medical social services, and home health aides. And the checkbox will be put into each place if they provide this service, or it'll be a circle with a line through it saying they do not provide this type of service. This obviously is good information when you make your first contact and as you move to develop with this particular client, because you will have a general idea of what positions they ultimately will be hiring for. Again, for example, if they provide nursing care, then I highly suggest that you talk to them about their nursing staffing. Typically, home health agencies are going to require one nurse for X number of visits per day. And usually that was somewhere between 6 and 10 home health visits each day, ranging anywhere between 30 and 45 minutes at length. A lot of these organizations also pay their employees by appointment rather than per hour. So we will definitely need to work together to come up with strong pricing to best affect those customers who are going by appointment. So don't hesitate to give us a call or email me at medical@snelling.com, and I will work with you to provide you with adequate pricing. If they have physical therapy, then it's likely that they're going to employ physical therapists, as well as, probably more so, physical therapy assistants, who are really going to do the day-to-day activities with your patients, or with these home health agencies' patients. Same with occupational therapy. We have occupational therapists and occupational therapy assistants. In some cases, they will also accept physical therapists to provide occupational therapy coverage. Speech-language pathology. So we have speech-language pathologists as well as speech-language pathology assistants. Medical social services, in most cases, are going to use a medical assistant or a medical technologist. And then, of course, we have home health aid, which could be anywhere between a CNA, an MA, or a candidate who has no medical training, but some basic skill sets that match your home health organization's requirements.